Welcome back. You're still tuned in to News and Views with myself, Salailo Makwidi. The time is 8:15 Central African time, and we're going to be kickstarting the show with a very, very important conversation. The NHI, the National Health Insurance Debate, which continues to roil in South Africa. Doctors and healthcare funders have seemingly signaled a willingness to talk with government about the NHI Act and how it should be rolled out, but they're still keeping legal challenges alive in court. What does this signal about the future of healthcare reform in South Africa? We're going to be unpacking that, and we'll now be joined by ActionSA Member of Parliament and Health Portfolio Committee Member, Dr. Kgosi Letlape. Dr. Letlape, good morning. Thank you so much for joining us. Always a pleasure.
Good morning to you, and good morning to the listeners.
Most definitely, and I think we'll jump right into it. Dr. Letlape, it's the new year, 2026. From your perspective, if you can briefly summarize where the NHI currently stands today, whether it's in terms of litigation, in terms of its rollout, and we understand that there are about 9 cases against the NHI. What are some of the principal legal concerns that are being advanced by doctors and funders, and what's your response to them?
Well, the main issue is the lack of clarity about what's going to unfold in the future and how. There's a section in the NHI Act which talks about long-term, the medical aids. Once the NHI can do what the medical aids are doing, the medical aids will only do what the NHI is not doing. Now, a provision like that is not a helpful provision. And it also means people don't know what's going to happen to their livelihoods and the businesses they've built over years. That provides no clarity. And that's the key area of confusion. There's other aspects that people need to take into consideration, where ordinary people are not taking the government to court. But none of us understand what's really going to happen. If you're on medical aid, you don't know what's going to happen. If you're not on medical aid, you don't know what's going to happen. If you're not employed, you don't know what is actually envisaged. You must remember that some time ago, prior to one election, you had a premier of Gauteng coming out and saying, once we do NHI, you can just walk into a private hospital as a citizen and you'll be taken care of. There are things that have not been clarified. And when you look at the work that has been done to date on what have been called pilots on NHI, they've been attempt at fixing certain aspects of the public healthcare system. Some of the things that they've looked at is at contracting with private practitioners. Now, that's something that requires no pilot. I have brought doctors through a small program that we're running called Tsepang to come and do sessional work in the hospitals. That does not require millions of rands to pilot. It just requires decision-making, proper governance, and proper administration. And one of the key issues that people need to understand is the fact that when your solution is to create a pot of money and you have not sorted out the problems of procurement, for example, of administration, for example, you are pouring money into a bottomless pit. So there are issues here about construction. Then you begin to worry about intent. And everything is about highlighting the deficiencies and scaremongering. When someone wants to scam you, they scam you based on your own needs. They scam you by giving you an easy passage to something that they know you need. Whether someone tells you can buy a car at a very cheap price, or I can get you this, I can get you work, etc. And when you look at this, at the center is the need that all of us have for security in terms of access to healthcare services. And that is being abused by government in terms of the way they do it. And what should concern South Africans is the fact that NHI is an act of parliament, but it's an act that does not impact parliamentarians. We are on a separate medical aid called PARMED, the most expensive medical aid in this country, which I would even dare say not affordable to its new entrants, given how much MPs earn. It is the most unaffordable, most expensive medical aid. Now, the MPs retain that, stay in there, and then they create an act for others. That is not acceptable. That is not acceptable. And you know, it is time that as South Africans, we start engaging, we start asking questions. I know it's very difficult. We're not raised for critical thinking. We're raised to be believers, and that is part of the problem. Don't believe any of them. Now, there are people that at the moment are making millions out of healthcare. They have a lot to lose. And basically, those are the ones that are taking the government to court. Because when you extrapolate it to the end, if NHI succeeds, medical aids fail. Now, why would you sit around waiting to be taken out? And that is part of the problem. And the department is disingenuous. All the people in the department, they're all on medical aid. Why have they not started by piloting themselves that we are going to show you how this thing is going to work? We are moving to NHI as government employees. We are going to NHI as the Department of Health. We are going to NHI and you're piloting it with us as parliamentarians, as public servants. None of that is happening. People are retaining their medical aids for now. Now, here's the danger. Once you've created the fund, it will be no different like the challenges that you have at a road accident fund. It will be no different like the seats that have been created that are being pillaged by politically connected people. Now, if you want to build a healthcare system in this country, a national health system should be based on a public sector that provides quality healthcare for no payment for citizens at the point of care. That's what a national health system should be. And if they were clear about that, and that there will be a dedicated health tax to add on the current funding mechanisms that go to the public sector, but all of us will use the public sector. I want to get rid of PARMED even before the issues of NHI have come in. And
I want to stick on that. Sorry to interchange that a little bit. I want to stick on that because I think it's a very, very important point that you're making. The role of medical aid schemes and providers. As you alluded, part of the contention regarding NHI involves and revolves around fears that medical schemes will be restricted once the NHI is fully implemented, and that independent practitioners also could struggle under the new accreditation rules that have been tabled. Does the committee see room for an almost hybrid model that preserves choice while still expanding access to healthcare for majority of South Africans who can't afford good quality healthcare and plug that hole that the NHI seeks to plug?
The model that will work is simple. We fix public healthcare for all of us and we all access it for no payment at the point of service. And you can do whatever you want. And if you are a responsible minister, you'd also be looking into what has been recommended by Health Market Inquiry, what the aims of the Medical Schemes Act is, and you're taking them back to the original Medical Schemes Act, where they've got to have a common package for all members, where they've got to guarantee care to members, where you've got to curb administration costs, where if you want to run a medical aid, you must be able to administer a medical aid. You can't run a business you can't run, that you are outsourcing to somebody else. So those are the basics that we could go back to. So it'll give you the situation that you are proposing of how do we have make people have choice while fixing the system. If you look at education as an example, even though there are challenges in the public schooling system, we don't know what the real attempts are for fixing the public healthcare system. People can go to private school. It is not forbidden. There's no threat that once we fix our public healthcare system, we will forbid private schools from offering what the public schools are offering, which is basically what is being suggested by the NHI. So you have a choice of working yourself to the bone and take your kid to private education. That's your choice. Or you can look for a public school that is accessible to you, that if you love your child is not going to spend 4 hours. He's not going to wake up at 4 in the morning to go to school and come back at 7 p.m. because then you are not a great parent. But you have those choices. And just to allude to something, the providers are taking them to court because of the insecurity that they are bringing to people that have dedicated their lives to choose a profession to serve society. Now, there'll be a committee somewhere that's going to accredit you. If you don't get accredited, you can't work. We're going back into the challenges that we have now of tendering. It's basically like saying, you're a doctor. You want to continue to do your work. You must get a tender. If you don't get a tender, you can't work. Accreditation is a form of reducing professionals to begging to do their work. And if the fund now says, we're not giving you work, where are you going to work if it's a national health system? It has to be anybody that is accredited by the professional bodies can do work. And any patient can choose any properly registered practitioner to go to for care. If, for example, they say you start with GPs, all general practitioners should be a part of the system. And the people should be allowed to choose a general practitioner of their choice. Or you map them and you say, GPs in this area, I have 100,000 people here. I have 1,000 doctors. This 100,000 people choose any of this 1,000 doctors that are here, etc., etc. So it becomes all inclusive. But what you're doing right now, you are creating a pot for massive, massive corruption and inefficiencies. That's why you're staying out of the system. Because what you're looking at is making money. You're not looking at serving the people. You're not looking at building this nation. You're looking at dividing it further and creating funds to steal. So for me, you just go back to the drawing board. You just become an honest broker and you work for the people of this country.
Very, very concerning, Dr. Letlape. One thing that stood out for me, and I think is very, very important, is the utterances of the finance minister, Enoch Godongwana, who has urged stakeholders in this NHI debacle to settle some of the disputes out of court, suggesting that litigation essentially will delay the implementation of NHI. From your perspective, is there a credible pathway to a negotiated resolution without undermining legal safeguards? Can negotiations be had outside of the courts? Can the NHI see light of day or not see light of day without the courts being involved?
The NHI as constructed right now is a heist in operation. And it needs to be stopped. So for me, we are a country that is a rule of law. And if there's a difference of opinion, why don't you go and state your opinions in a court of law? If the government feels NHI is righteous, they should welcome the people that are taking them to court. And they should go to court and defend themselves. We can't have a settlement amongst thieves, in my opinion. That should not be done. So if the other side is genuine in terms of the issues that they want to take to court, they should pursue them in court and the courts must decide. Now, I find it disappointing that the finance ministry would be saying, find a settlement. NHI is a money bill, effectively. And Treasury and the finance ministry have been silent about how NHI is going to be funded. They've not been clear about that issue. And if there was genuine intention and there was cooperation and there was agreement within the government sectors, they should be clear to come and say, this is how we're going to finance NHI. We're going to take 3% of what you earn, and your employer is going to put in the other 3%. It goes into a fund. And this is how this fund is going to operate. Now, that aspect of how it is going to be funded, how they're going to extract money from us, has not been clarified. And people are talking about defining a package, employing people that are going to define the package that you have. You don't need that. You're wasting money. If you look at the public healthcare system now, there's no definition of package. You go there, you're sick, the state will take care of you. You know, the issue of what level of care can be provided, what treatments can be provided, those are clinical decisions. And you leave them to the clinicians. You don't create a board that says, we'll cover the little finger, we won't cover the ring finger. That's not money well spent. That's idiocy. When you start rationing, you are not giving universal care. And you are not ensuring that people are treated equally based on their needs, rather than based on a rationing system decided arbitrarily somewhere by people that are not patient-facing. So for me, it is a travesty that now that the heist is being stopped, people then say, hey, let's talk on the side in terms of how we devour this cake.
Let's settle out of court.
Let's settle out of court. No, there should be no settling out of court. If there are things that are unlawful, that can be challenged by the Constitution, all those that are putting the challenges owe it to us for seeing this through. So that our courts can be an arbiter on the constitutional validity, the fairness, and the appropriateness of what is being proposed. You can't be, if you've come and you say the WHO backs this and you are backing it, be thankful they are taking you to court so that what you are doing can be backed by the courts of this nation. It would be quite interesting because, all those that you're going to argue in front of are on medical aid. And the judges are with us.
Dr. Letlape, we're running out of time, but you're making a very poignant point there. Lastly, before I let you go, South Africans want to know, as we head into 2026, how is the conversation around NHI evolving? Are South Africans going to be receiving NHI? Will there be a rollout this year, the next year? Is it going to see a light of day? Just a simple synopsis of where we currently are and what should South Africans expect, especially going into 2026?
South Africans to stop being deluded by the mirage of NHI and ask this government to fix public healthcare system. We should ensure that people like Babita Deokaran that paid with their dear lives didn't die in vain. And all we need to do is to fix the public healthcare system. And all we need as members of parliament is to be allowed the choice of whether we go separate from the rest of South Africans or we choose to be with South Africans by not being forced onto a medical aid. It's that simple. That's what South Africans should demand. None of this flowery stuff where people are going to create pots of money that they're going to dig into, and there'll now be battles about who administers this fund. We create a statutory structure that is responsible for the funds that we have. Just like we have treasury that is responsible for where the monies go. Terms and conditions are given to where the money goes. And there's oversight about using that money in accordance with the Public Finance Management Act. So if we're going to create a fund, it should be, this is where the funds will be going. These are the terms of reference, and it should be a state body that does that, not a committee that then gives people tenders. People, let's wake up. We can't even sort out a licensing machine. because of this sickness of tenders, where things are not being insourced and are not being provided by the state. The future lies in ensuring that public services, whether they are public roads, whether they are public transport, whether they are public health, work for all South Africans. And that becomes a point of solidarity. If it is not for all of us, it is not worth supporting.
Well, there you go. Dr. Kgosi Letlape, Member of Parliament with ActionSA, and also a member of the Health Portfolio Committee. Thank you so much. Always a pleasure having you on air. Really appreciate it.
Yeah, thank you.
There you go. NHI conversation, still a very, very tough one. Thank you to Dr. Letlape there for that clarity. It's very, very complex, and very complex, but yet very, very consequential matter. What are your thoughts? I want to hear from you. Should we, South Africans, pause, try and renegotiate the NHI? What does it mean in true lived literal terms? How is it going to be funded? What happens to medical aid? Many South Africans are on medical aid. What happens to medical aid? Or maybe we should just stay the course and push through the reforms despite the ongoing court cases. Do you want the NHI? Do you think the government has the capacity to roll out a national health insurance bill where everyone gets universal health care? In simple terms, walk in any medical institution and seek assistance. Or you think the government doesn't have that capacity and they should rather focus on fixing the public health sector? Because you can't fail on something that's already in existence and, as Dr. Kgosi Letlape said, outsource a new business, start a business that you can't run and then outsource it to someone else. What are your thoughts on the NHI? You can engage with us. Our studio line is 061-766-0355. And you can join the conversation on X, on Facebook, and on YouTube. Use the hashtag News and Views, and we'll read your comments live. Otherwise, we're going to take a quick break. News and Views continues after this.